We're going to look at the subscapularis now in long axis and in short axis. The easiest thing to do for you as a beginner is to make a scan that you already know. We make the scan of the biceps inside the bicipital groove. And then from this position, we just ask the patient to exo-rotate the arm. So go to maximum exo-rotation, and then in the image you can see that into view came the subscapularis right there. You see? So now we have the subscapularis tendon. It's coming down here. This is the footprint of the subscapularis. This is the superior border and it ends here. And this is the lower border and it ends here. So all this is footprint of the subscapularis. We go a bit more medial now. So we slide the probe medially and then we see the cartilage of the humeral head. Very nice image here. And here we see the tendon going down deep on the deep side near the cartilage of the humerus, and then superficial to it we can see a muscle belly, and this is the muscle belly of the subscapularis. People that are unexperienced, if you look at this, you might think it's a bursa because it looks very hypoechoic, but a bursa would not move together with the tendon like this. So that's how you can distinguish it from fluid. We go a little bit more medial and then we see a bone, and this is the bone of the coracoid. Here is the muscle belly, tendon and the bone, and here if you do a dynamic maneuver like this, you can actually see very clearly, very nicely the subscapularis moving under the acromion. Yeah, so this is the long axis view. Then we do the same trick. We start from the neutral position. So as again, for a beginner, it's nice to start from the position that you already know. So we scan first the proximal biceps inside the groove like this. And again, we ask the patient to exo-rotate the arm. And if you do this maneuver, then the subscapularis will come into view by itself. Sometimes you have to go, if you look at my probe now, you can see that you have to go a little more proximal. So we go a little bit proximal. Usually you have to scan it a bit from top down. Yeah. So let's take a look if we can do it. Now I'm going to do the maneuver again. So we look at the screen and we see the biceps. We go to exo-rotation and we see the tendon coming into view. Now I need to optimize the image a little bit, so I go a little bit more cranial. And I move the probe in this direction. And I try to get, this is okay, this view. We freeze it. So what you're looking for actually is a flat bone surface that goes down here and goes down here. With this particular subject, it's difficult to actually see it very much as a line, but you get the idea. This should be more or less like a flat line, and then we see the tendon here overlying the whole flat line of the facet right here. This tendon can be a bit irregular. You see some dark hypoechoic areas in there. That's normal because it's comprised of a lot of different tendons together. So sometimes you see these changes inside, and that's a normal finding. So that was the long and the short axis of the subscapularis.